Hello, my name is Lupe, and I'm an advocate here in the Boyle Heights area, and I'm excited because I'm here with Nicholas Luna, ready to ask him some questions and to learn from him. Hey Nick, how are you?
I'm doing really good. It's a great day. I am looking forward to educating you and educating others about Medicare today.
Oh, that's great, Nick. So tell us about who's Nicholas.
Sounds good. Well, my name is Nicholas Luna. I have been in the health insurance industry since 2008. I have been an agent since 2016, specializing in Medicare, and I have been servicing the East LA area for the last 8 years.
That's great, Nick. You did mention Medicare. What's Medicare and who's eligible to apply for Medicare?
Very good question. So who is eligible for Medicare? There's going to be 3 people that are eligible for Medicare. The first person that's eligible for Medicare is going to be someone who's been labeled disabled by the US government and they're collecting at least 2 years worth of Social Security. The second person that is eligible for Medicare is anyone that's been diagnosed with end-stage renal disease, which is people who are on dialysis. And the third person that's eligible for Medicare is anyone that is turning 65 years.
Is there anything that Medicare does not cover?
That is a very good question. So Medicare Part A and Part B are gonna cover the very basic needs when it comes to your medical needs. Part A is gonna cover the hospital. So any hospital stay, any outpatient service. So for example, you're gonna get a surgery. Part A will cover the hospital. Part B is going to cover the surgeon who's actually providing or who's actually doing the service and doing the surgery.
Ah, okay. And is there any different parts of Medicare?
Actually, there is. There are 4 different parts of Medicare. Part A, which we just mentioned, is for the hospital. Part B is for any medical professionals. Part C, which is a combination of everything. It's gonna cover the hospital bills, it's gonna cover the doctors, it's gonna cover your prescriptions, and it's gonna cover extra costs like your glasses or hearing aids or dental services. And then the last coverage is Part D, which only covers prescriptions or any type of medical drugs that your doctor prescribes. You'll be able to use Part D to cover that.
So I heard some residents do have Medicare and Medi-Cal. Can you tell us a little bit about that?
Yeah, I'm gonna go into detail when it comes to Medicare and Medi-Cal. So Medicare is a federal program. It's something that we all pay into. And Medi-Cal is going to be state-sponsored insurance. So because we live in the state of California, that's why it's called Medi-Cal. Across the United States, it would be called Medicaid. When someone is on Medi-Cal, it's because they live below the poverty level. So in order for someone to be eligible for Medi-Cal, there are some income requirements that they need to meet. Now, when it comes to Medicare and Medi-Cal customers or beneficiaries, there are people who can combine both of them with the insurance company and they get additional benefits when it comes to their coverage.
So Nick, how does someone become eligible for Medicare?
It's a good question, Lupe. So in order for someone to become eligible for Medicare, they need to at least work for 10 years. If they work for 10 years, they're gonna get Part A for free. Now, when it comes to Part B isn't free. Part B is paid for monthly, and it's gonna have a different cost based off of your income level. Now, if you are not working, but you are married and you're filing your taxes jointly, you can use your spouse's income or work history to cover your 10 years. So if you are a stay-at-home mom, have no worry. As long as you file taxes together with your husband, you'll be able to cover that 10-year period based off of your husband's work history.
So Nick, how do people qualify for Medicare Advantage plans? I do hear those plans cover the glasses, dental, and gym memberships.
It's a good question, Lupe. In order for you to be eligible to get a Medicare Advantage plan, you need to have Part A and Part B active. Now, during certain periods of time, people can enroll into Medicare Advantage plans. I'm going to go over the different stages when someone can enroll into Medicare Advantage plan. When someone turns 65 years old, they are able to enroll into their Medicare Advantage plan of their liking 3 months before their birthday. They have their birthday month, and then they have 3 months after their birthday. If someone already has Part A and Part B, and they've never had a Medicare Advantage plan, they can enroll into a Medicare Advantage plan during annual enrollment period, which is AEP, which happens every year from October 15th through December 7th. If someone is moving out of an area and they're moving from a different county, from Riverside to Los Angeles County, they're able to enroll into a Medicare Advantage plan in their area, because when you move to a different area, the plans do change and the benefits do change. And also, if there is some sort of loss of employment, now let's just say someone had a job, they retired, and now they're going to enroll into Medicare, they have 60 days to enroll into Medicare and a Medicare Advantage plan.
Nick, also, can you explain us a little bit about the star ratings? How does that work?
That's a great question, Lupe. So when it comes to star ratings, the government has a scale from 1 to 5. Whenever we talk to beneficiaries and they're talking about a particular plan, we have to make sure to let them know of the star ratings of that plan, so that way the consumer knows what the government rated them.
That's great information, Nick. How can people contact you if they have any questions?
It's a really good question, Lupe. If anyone wants to get in contact with me, we are going to leave a phone number directly below here. That way you can reach out to us and we can answer any questions for your Medicare needs. We will also give you our website, which is nicholaslunabroker.com. And if you prefer email, we will go ahead and list our email below.
Thank you, Nick, so much.
No, thank you, Lupe.